So ma'am, what are the future upcoming advancements are you excited for, ma'am?
So now, if you see IVF, when they started, it was like the eggs were taken outside the body. Basically, that is what IVF means, in vitro fertilization. So in vitro means, vitro is glass, in the glass, so it's test tube baby. So you take out the eggs outside the body, and you take the sperm, you combine one egg with one sperm in the lab. So the fertilization happens in the lab, and those embryos, then they develop in the lab. So 45 years ago, what they were doing is, after combining, immediately next day after fertilization, day 2 embryos, they were putting back into the uterus. So what happens is, like, to give you simple example, like when we sow seeds for germination, not all seeds will germinate. Even when they germinate, not all will become saplings. All those which become saplings, not all will become big tree. So this depends upon the potential of that seed. So same it is with the embryo. So when we select the good embryo, then there are more chances of having a healthy baby, or having the implantation successfully, continuing the pregnancy for 9 months and delivering the baby. So how do we know? So you will not know until that seed becomes a tree, right? So how we do that in the lab is, we keep those embryos in the good environment in the lab. So the optimal conditions, like they say, which is the best incubator? So best incubator is mother's womb, but we still don't have mother's womb in the hospitals. So that still can be a future, that artificial wombs they are working on, but at least as of now the artificial wombs are not available. So what we have to do, we have to mimic the conditions in the womb outside. So what is important for your success of IVF? Selecting the right center which has advanced technologies, which has experienced, knowledgeable, skilled doctors, which has a good team of embryology with experts who are properly trained, skilled. Also, all the advanced treatments like laser assisted hatching. There's a special equipment called laser lens which comes for the microscope. So we help in embryo hatching by putting laser. Then there is PGT, that is pre-implantation genetic testing for embryos. So it is done by doing embryo biopsy of the day 5 embryos. Also now, to make sure that there is no gamete mixing, because majority of the patients have this issue. They will think, what if they don't use my husband's sperm? What if it gets mixed up in the lab? So there were movies also on the same topic, that the gamete mixing happened and somebody conceives with not husband's sperm but somebody else's sperm. So all those things, we have to be very vigilant, and we have to make sure that the couple has pregnancy with their own egg and sperm. So now we have machines and artificial intelligence to help us to make sure that these things are taken care. So these gadgets are there, like RI witness system, which will be acting as a witness. So what happens in that is, we give the patients a card which has barcodes. So these barcodes are like only to that particular couple. So their sperm sample, the semen sample, will also have that barcode on the tube. Their dish where we are taking the eggs or embryos will also have that barcode. And then there is sensor to the lab platform where we are doing these procedures, where we are handling the semen sample, where we are handling the eggs, where we are keeping the dish, where we are doing the ICSI, combining the egg and sperm. So this has these codes. So when we put a card of the patient in the machine, it will read the code. And the working platform where we are keeping these samples will not allow any different code which is present on any test tube or any dish to come nearby. It will give alarm. So it's not just the embryologist physically checking and cross checking, but also the system with the reading of the code, which will give alarm if wrong sample or mismatched sample or somebody else's sample comes to the working table. So you can be 100% sure that this is your own egg and your own sperm. So that is how the RI witness helps. So when you're selecting a center, you have to see which centers are using all these advanced technologies. Also, there are now alarm systems for monitoring or constantly, actually, rather second by second monitoring of the incubators and the lab, because that is the heart of our centers, that embryology lab. Incubator is like mother's womb. It has to have the environment which is best for the baby, best for the developing embryo. So those conditions we have to constantly maintain and monitor. If suppose suddenly some gas is over, or if there is a some failure of the cooling or failure of the incubator temperature maintaining, then what will happen? Then it will damage the embryos, right? And then if we are doing this treatment for success, the damaged embryo is not going to give you the result. So we have to make sure that all these things are taken care in the lab. So there are these alarm systems like Ziltrix system what we are using. So these alarm systems, what they do is they will maintain the record, and if there is fluctuation more than required, even not even somewhere where it will affect the embryos, much before that, it will give alarms. So the embryologist will have these alarms in their phone. There will be different places in the hospital where those alarms we can listen to, and they can act immediately. Earlier when these things were not there, then what, or some centers now also, if they don't have these things, what may happen is suddenly power failure. Okay, so the incubator now which has this connection, now because of the power failure, that temperature it cannot maintain, it might drop. Ideal temperature will be 37 degrees. So if it drops, then it can damage the embryo. Power failure means incubator is gone. So now that is not. We have backup of the generators, we have UPSs in the lab, we have Ziltrix system to give alarms much before it can do any damage. So all those things which are present in a center, along with the good staff which can support you in these difficult or complicated treatments. So patients should look for such centers, and then the success rate will definitely be on higher side. So as we see that because of all these advancements in the lab equipments, in the like about the embryo incubation also, like as we saw that second day embryos they used to transfer. So now we have moved on to blastocyst transfer, day 5, day 6. Same embryo which is coming from the tube for implantation, that same embryo we are allowing the embryo to develop till that stage in the lab, and then selecting best grade of embryo to put back. So that is blastocyst transfer. So that is also an advanced technique to increase the success. PGT, diagnosing the genetically normal embryo by doing the embryo biopsy. That is also helping the patients. So all these techniques are, which are advanced techniques, are helping the patients to have higher success rate of IVF.